I think there's a misconception that when you go to the ER and you see an ER doctor, that he's there to take care of every facet of your issues. And that may not be totally accurate. ER doctors are trained to understand what your issues are. If anything's life-threatening, of course, deal with it. If anything's serious, deal with it. But for other things, they may leave minor issues for you to follow up with your primary care doctor or even a consultant. So if you have a rash or a mole that you may bring up to an ER doctor, he may say, yeah, please follow up with your primary care doctor with that, or, please see a dermatologist for that. Because in their mind, what they're trying to do is they're trying to stabilize you, diagnose you, and literally try to get you out of that bed, because the next person waiting for that bed may have a life-threatening issue. And depending on their capacity, they're not there to take. So if you walk in with 10 problems and only one or two of them are life-threatening or need immediate attention, often they're only going to address those one or two problems. And I think to a certain extent, that's a misconception. I think people come in and say, well, I've got these 4 somewhat related problems, so I'm sure I'll get all 4 addressed. I'll find out, what this is. I'll find out what that is. And that's not the case. They're only going to address things that need to be addressed, and things that can be managed as an outpatient are probably going to be pushed in that direction. So just understand that you may be given homework, to follow up with a whole array of medical people, depending on what your issues are when you land in the ER. It is not the place where you can literally get everything on your grocery list done. And same thing if you go to an urgent care. They will take care of anything that's time sensitive, but they're not going to say, oh, let's biopsy that mole and see what that mole is. They will defer that to either a specialist like a dermatologist, or they will defer it to your primary care doctor, because they're on the same playing field as an ER doctor in terms of they kind of feel their job is to diagnose what needs to be diagnosed and that's time sensitive. But anything that's not time sensitive, they may, start you off on the right treatment for some chronic or mildly chronic issue, but they're not going to want to jump into the deep end on anything that's sort of not, if you say, well, I've had this back pain, for 5-10 years or 3 months or 6 months, and I just want to get it checked out. They may start you on some therapy and whatever, but they're more than likely going to refer you to somewhere where you can eventually get an MRI or be seen by a specialist or what have you. If you assume the clock is ticking, on some level it has to be, because they've got other patients who might be more sick than you. So if you go into excruciating detail about something that's a chronic issue that you want to address, you may not get the response you think you're going to get.